Hey guys, and welcome back. So right now we're going to be looking at the need-to-know structures and pathologies referring to the leg and the foot here. We're talking about the from the knee down essentially. So let's look at some of those important structures here. So first, knowing some terms for our general understanding of locations and regions of the body. So the first thing we're going to look at is the crural region. The crural region refers to the shin. So the crural region is the front of the leg, while on the back of the leg we call it the sural region. So the sural region is on the back of the leg here. So just as we had in the forearm and the hand, we had a bit of connective tissue in between. As we know, we see that there's a gap in between the tibia and the fibula here. We have, again, what we call the interosseous membrane. Inter meaning in between, os referring to bone, os means bone, membrane, it is a sheet, a thickness of connective tissue. So this is an extension of the periosteum that bridges, connects these bones, binds these bones, supports these bones, and serves as muscle attachment sites, the interosseous membrane. So then we look at some of the ligaments, as we've already mentioned in the lecture on joints. We had the very important ligaments in the knee. We had the MCL and LCL, which stands for medial collateral ligament. So these are the ligaments that run straight up and down. They're like taking two pieces of tape and slapping them onto the sides of the knee. So one on the medial side and then one on the lateral side. So the medial collateral ligament and the lateral collateral ligament. Then, of course, inside the knee, deeper into the knee, we had the cruciate ligaments. We had one in the front, one in the back. We had the anterior cruciate ligament and the posterior cruciate ligament. So the cruciate ligaments really deep into the knee and they cross. Don't forget about the patella here. The patella is that sesamoid bone that grows in that quadriceps tendon here. On top of other structures in the knee, we don't forget about the meniscus, that little gasket there. And then other ligaments that were important were called the deltoid ligaments. The deltoid ligaments are the ligaments that are on the ankle. And these are usually the ligaments that we tear when we roll or sprain our ankle. So we have the deltoid ligaments. They're in the ankle. Don't confuse them, deltoid ligaments, and think your shoulder or your delts. Deltoid ligaments in the ankle here. So just as we had in the forearm and hand, we had a thin band of connective tissue that essentially was like my wristwatch here, one on the front, the flexor retinaculum holding down my flexor tendons, and then on the back of my wrist, the extensor retinaculum holding back my extensor tendons. Well, we have something very similar on the ankle and foot here. We have one on the flexor side, we have the flexum retinacula, and then the extensor retinacula. So again, a band of tissue on the flexor and extensor side just holding those tendons down. So then we look at the foot here, and we're going to see a few structures. So first, notice the topography of the foot, right? We know that we have arches to our foot. So here we go. We're going to take a little look here. So we have three arches we look at with our foot. So if we were to draw a triangle on our foot, we'd start with the point being here on our heel. We'd draw one edge of the triangle towards the base of our pinky toe and then towards the base of our big toe. So this is the mapping of our arches. So the line of this triangle that runs to the big toe is what we call the medial arch. The medial longitudinal arch, because it's long, longitudinal, it's going long. So that's the high arch that we have, that we all refer to, where we want arch support in our foot. So on the other side would be the lateral longitudinal arch here. The lateral longitudinal arch. And then that border of the triangle that crossed in between the pinky toe to the big toe is what we call the transverse arch, because it's running across. So those are the three arches of the foot: the medial longitudinal, and then the lateral longitudinal, and then the transverse arch. And so we'll see some conditions where these arches have failed us. So that's going to do it for the important structures. Now let's go ahead and take a look at these pathologies. So the first one we're looking at is a blister. I'm sure many of you have gotten a blister before, and you can kind of understand where you got that blister from. So if you're digging in the dirt or in the garden and you're using a shovel and you're getting that constant friction on the hand, you might develop them on your hands. Or if you're walking around, say, Disneyland for hours on end, you might get blisters on the bottom of your foot. Blisters are caused by friction. So that constant friction creates that heat, which then essentially causes the burn there. So it's just very similar to a burn. So if you ever get a burn and you see it blisters up, it bubbles up, and there's pus, serum, and plasma underneath that, well, that is what a blister is. So in relation for massage therapy, just avoid the area. It's not an absolute contraindication. We just want to avoid it. Don't pop it. And if it pops, make sure you clean it up accordingly, but don't try to pop it. Now, the next condition we're looking at is called gout. Gout is also referred to as king's toe. Why? Because maybe kings were very prone to develop this, because gout usually refers to uric acid crystals. And these crystals will usually deposit in your big toe. That's where they start, and then they can move upwards and come into the knee. So these uric acid crystal deposits come into the big toe, king's toe, and it's usually based because of diet, usually a high meat and alcohol consumption diet. So when I think of gout, I think of a big, hardy, beefy king sitting in his throne, ruling his kingdom with a big mug of grog and a huge turkey leg, just feasting away constantly and endlessly and developing the uric acid crystals. Not much massage therapy can do for this. Just be careful when moving or working with the foot, especially around the big toe or the knee, and to try not to cause any discomfort. So of course we know that we have fractures, right? A fracture is a complete or partial break in the bone, so we can have any of these bones fracture. We could also have an ankle sprain or an ankle strain. So remember the difference between a sprain and a strain. I can't stress that enough. A sprain is an injury or tear to a ligament, and then a strain is an injury or tear to a muscle or tendon. Now, typically there are 3 grades to strains and sprains: grade 1, 2, and 3. Usually grade 1 is micro tearing, and it's almost, you wouldn't even probably notice you did it. And then upwards to grade 2, you would probably feel it. And grade 2 can be pretty wide. It could be from mild to rather severe. And then grade 3 is usually complete tearing or extreme tearing, which usually requires surgery. So grade 1 heals on its own. You probably didn't even know you had it. Grade 2 is more than likely going to take a longer length of heal. Might not need surgery depending on where it is on the spectrum. Grade 3, you definitely are more than likely going to need surgery or other rehabilitative measures. So the next thing we're looking at is called compartment syndrome. So compartment syndrome is a condition referring to the calf in the big region here. So if you actually were to take a picture of a calf, if you were to take this calf and then you were just chop it right in half right here, make a transverse cut, and look down, you would see that all of these muscle groups are compartmentalized into these little pockets separated by fascia. So there's deep pockets, deep compartments in the calf here. And so what happens is there's swelling or compression or broken blood vessels deep in these compartments, which then causes problems. So it could lead to blood clots, it could lead to other slew of issues. So if your client knows and says they have compartment syndrome, really don't work on their legs. I probably wouldn't even want to work on them at all without at least having a doctor's note letting me know that it's okay and that they would recommend a massage for relaxation or anything like that. But otherwise, just avoid the area there. So the next condition we're looking at is tarsal tunnel syndrome. So tarsal tunnel syndrome, very similar to the cubital tunnel or radial tunnel syndrome. Tarsal tunnel syndrome is, again, we have a little passageway right here by the medial malleolus, where nerves and other structures run through. And so tarsal tunnel syndrome is a condition where that space becomes limited, compression, pressure comes into the area, and then causes, you know, bad stuff there that we don't want to happen. So and then just really avoid the tarsal tunnel if it's a problem. Of course, we can have arthritis in any of these joints here. So osteoarthritis is our general term for arthritis, just OA, osteoarthritis, just a breaking down, especially remember this, hyaline cartilage. It's a wearing down of the hyaline cartilage, which is the cartilage on the articulating surfaces of bones, and it wears down and creates bone-to-bone contact, and it's very uncomfortable. So of course then we see another condition called Achilles tendonitis. So breaking down the name, tendonitis. Remember, tendon is a tendon. Itis is inflammation. So this is an inflamed tendon. Achilles tendonitis. Well, this is the Achilles tendon, or as we learned, is also known as the calcaneal tendon. So this is inflammation of the calcaneal tendon, usually an overuse injury, and massage can be very helpful with it, but in helping to reduce some of the inflammation and some of the pain. But other than that, not much. Now, the next condition we're looking at is called foot drop. So very similar to wrist drop, where we said we had damage to the radial nerve, because the radial nerve will innervate our extensor muscles, which doesn't allow our wrist or hand to extend and causes our hand to drop. Foot drop is very similar. So it's actually damage or irritation to the common fibular nerve, which then would innervate the dorsiflexors of the foot, which then allows the foot, or brings the foot into plantar flexion, and so our foot kind of drags as we move. So depending on what, you know, has caused this condition, you know, massage might be helpful, might not be. Now, the next thing we're going to look at is a shin splint. So pretty sure many of you might have heard of shin splints. Shin splints are micro tears in the muscles, or in extreme cases, microfracturing in the bones of the shin. So the muscles of the shin have micro tearing, or in extreme case, the shin bones, the talus and the fibula, mostly the talus, start to have microfracturing. Massage can be very beneficial for the shin splints, as we can help to promote healing and create a nice healing environment in the shins or shin muscles there, and you know, help get any inflammation and any you know, excess swelling out of the area. But other than that, it really should just be best to heal on its own. The next thing we're going to look at, we've mentioned this before, but a contusion, just to bring it back up again, a contusion is a bruise. Remember, contusion is a fancy term for a bruise. So the next condition we're looking at is plantar fasciitis. So plantar fasciitis. So first, that kind of brings me back to an important structure that I forgot to mention, which is the plantar fascia, right? We know fascia is connective tissue, and so on the bottom of the foot is a big sheet of connective tissue called the plantar fascia. So the plantar fascia is the connective tissue, the big web of connective tissue on the bottom of the foot. Plantar fasciitis is inflammation and irritation of the plantar fascia. Now this is, it could be an overuse injury, and there's a lot of onset to this, usually developed in runners or people who walk a lot, you know, people who stand a lot. It also could be caused by a heel spur, which we'll actually look at as a pathology. A heel spur is a growth of bone on the heel, and so this would actually be underneath the heel and would actually be irritating the plantar fascia, kind of scraping on the plantar fascia as it moves. So in that case, if it's caused by a heel spur, there's not much massage can do but help to alleviate any pain, but it's not going to be corrective. But massage therapy can be very beneficial in plantar fascia if it's an overuse injury. We can help to reduce that inflammation, especially using cold on the area, as well as keep your mind outside of just the foot. Also work those calf muscles too. So working the foot, working those calf muscles, you know, can really help with getting rid of plantar fasciitis. We can really get into plantar fasciitis. I'd love to get into plantar fasciitis, especially about how I use cupping on it. I might save that for another video. So the next condition we're looking at is metatarsal, also called Morton's neuroma. So this is a thickening of the tissues underneath the foot, which causes irritation to the nerves and pain in the toes. So massage can be beneficial in pain management, but nothing on a more corrective sense. The next condition we're looking at is deep vein thrombosis. Break down that name. Deep. It's deep. Vein. It's a vein. Thrombosis. A thrombus is a blood clot. So osis is the condition of, so thrombosis is the condition of having a blood clot in a vein that is deep. So in this case, it's in a deep vein of the calf here. So usually DVT, as it's acronymed, is more common in the leg, in the calf region, going hand in hand almost with that compartment syndrome. So DVT is a complete, absolute contraindication for massage. Get your client out of there. Make sure you do not massage them, especially without doctor's clearance. And I wouldn't massage them until the doctor's clearance said that there was no blood clot. So the next condition is athlete's foot, right? We've all heard of athlete's foot, so get some boom, tough actin, tenactin, don't sue me. And the athlete's foot, well, we need to understand, one, it's a fungal infection, so therefore we need to understand our sanitization protocols in dealing with certain pathogens, right? We know that it's the different procedure for working with bacteria, it's a different procedure with working for a virus, different procedure with working for a fungus. So an athlete's foot is a fungal infection and needs to be treated with a fungicide. And massage therapists are not going to be treating any funguses with fungicides, so just avoid the foot. Characteristic signs to see if your client does have athlete's foot: one, if they tell you they play a sport and you see some of these signs, then you can kind of just safely guess. But usually like yellowing around the toes, around like in the webs of the toes, like yellowing and then other discolorations, as well as they might be red from itchiness. And of course there would be a bit of an odor, and an unnaturally stinky foot odor. I know feet are usually stinky, but this would be a little more unnatural there. So the next condition we're looking at is clubfoot. Clubfoot is not what you go out with on Friday night. This is actually a birth defect which causes the foot to be kind of gnarled and clubbed up like a billy club. Almost looks like the end of the femur here, like a club here. The next condition would be diabetic foot. So diabetic foot usually comes from neuropathy, so usually diabetic neuropathy occurs here. And essentially with diabetes, usually type 2 diabetes, usually diabetes ensued from poor diet and unhealthy weight, we know that we don't have as good mechanisms to drain blood from the lower extremities. So blood pools in these areas, and then of course with neuropathy we lose feeling into the foot, and then a slew of other things. And plus, without the proper circulation in the foot and everything here, there's very limited amounts of healing. So that's why usually people, diabetics, will start when they have to amputate, they start from the feet and work their way up. So that amputation is because usually like a cut or some kind of injury happens to the foot and it's not able to heal. And so since it's not able to heal, the area becomes necrotic and then would just end up causing a slew of problems to health, and so we just cut it off. So something similar here. So if your client has diabetes, pay attention to their feet, right? Diabetic foot, because they might not know that they have stepped on something or cut their foot on something or anything like that. They might have stepped on like a Lego piece or a thumbtack or a nail, and they might have objects either in their foot, or they might even have, cuts on their foot, which they might not know about, and it's, your best interest to inform them so that they can go seek the proper care. So diabetic foot usually caused by neuropathy and poor circulation, leading to an inability to feel in the foot. So massage for diabetes on the foot, you need to be careful and proceed it with caution, but it's usually very beneficial as we can help promote the blood flow in the area, but we would want to do so very cautiously. So the next condition we're looking at is flatfoot, called pes planus. Pes means foot. Planus means like a flat plane. So pes planus is a flat foot. So we can kind of guess based off of learning about the arches of the foot what this means. So that we also call it fallen arch. So that means that medial longitudinal arch has now flattened out, and that the foot is now, the medial side of the foot is now touching the ground, which can cause problems throughout the entire kinetic chain. And massage can be helpful in managing any pain that might come from the area, but nothing to help with making the arch come back up. So the next thing we're looking at is pes cavus, right? The complete opposite. Pes meaning foot, cavus meaning like a cave. So this is high arch. So pes cavus, pes planus. Planus, flat. Cavus, caved, right? So this is high arch, which means that the arch is really high up. It's an excessive arch on that medial side there. So the next condition we're going to look at is called hammer toe. So hammer toe, very similar to like if you ever look inside a piano, there's little hammers that hit the strings to make the sound. So the toes, just like if my fingers were my toes here, the flexor tendons that run to the toes contract, the muscle contracts, and then rears and curls those toes up into looking like little tiny hammers in a piano. Now, massage can be very beneficial in helping to relax and relieve the flexor muscle, but other corrective things would be wearing the proper shoes. Because usually I've had clients with this and they just didn't wear the proper shoes for a long time, and it was too late before they started wearing the right shoes that they already had developed the condition. But I was able to manage and help, relax those flexor muscles and allow their toes to start to straighten out. So hammer toe is the little curled toes there. We've already mentioned a heel spur. Like we said, it's a spur. A bone spur is a growth on the bone. Think like a cowboy boot. A little spur is that extension with a little spike there. So a little spiky ball of bone develops anywhere, but in this case, heel spur, it develops on the heel. And then the last thing we're going to look at is a plantar wart. So a wart on the hand, a plantar wart. Or excuse me, on the foot. Plantar, because it's on the foot. Plantar, we're planting the foot down. So plantar warts. Warts are contagious, so please do not touch them and avoid the area. And maybe just avoid their massage anyways. Nah, I'm just kidding, don't turn your client away. But a plantar wart is technically a form of HPV and is contagious, so do your best to avoid it. Now, don't freak out and go crazy, just avoid the area. And usually the warts are easy to remove. You can go to your local store and get a over-the-counter little thing and freeze it off. So nothing too major to worry about. So, well guys, that's gonna do it for the need-to-know structures and pathologies of the leg and the foot. Go ahead, take your notes, and if you have questions, let me know, and I'll see you in the next video. Have a great day.